According to the World Health Organization, 1 in 6 adults worldwide faces issues around infertility, with hormonal imbalance being a very serious issue for many women. So today on Gyna Plus, I have a special guest who will be talking about hormonal imbalance and everything that you need to know. Now, having said that, this is saying a very good evening to you and welcome to yet another very informative and interesting episode of Gyna Plus Radio on Africa TV, where we talk about health issues that affect women and girls in the society. And this show comes up every Wednesday at 6 p.m. And yeah, you can catch up with a repeat broadcast on Saturday at 8 p.m. As you already know, my name is Doris Mayum Shishe. At this point, we're going on a short break, and once we are back, you'll meet my guest. Please stay tuned. Welcome back. If you just joined me, you're still watching Gyna Plus Radio on Africa Television. And this is where we talk about everything health that affects women and girls in the society, of course. And my name is Doris Mayum Shishe. Before the break, I mentioned the fact that I'm going to have a very special guest who will be talking to us about hormonal imbalance. And this is not something that is very new to a lot of people. For some persons, they're already experiencing it. For some, they know someone who is going through it. And there have been lots of misconception stories around it. Some will tell you it's something you can't. I mean, so many stories that today you're going to hear firsthand from an expert what this is and how it can be handled should you be going through it. Now, having said that, at this point, I'm going to welcome Dr. Duke Onyabochukwu. And Dr. Duke is someone that is really special. And this is not his first time coming on Gyna Plus, by the way. You probably would have seen him in one of our episodes somewhere outdoor shoot. Dr. Duke is a consultant obstetrician and gynecologist at the University of Nigeria Teaching Hospital Ituku-Ozala, Enugu. Dr. Duke Onyabochukwu, it's good to have you again on Gyna Plus.
Thank you very much, Madam Doris.
Yes, when I saw you before we came on set, I talked about your fabric, kind of similar to mine. Yes. I have a thing with colorful fabric. You look good, by the way.
Thank you very
Welcome.
much. Thank you.
Yes, hormonal imbalance is the discourse for today. And like I mentioned before, it's not particularly new in terms of, that nomenclature, something that we probably be hearing for the first time. But take us through the brief meaning of baby hormones, then hormonal imbalance. Let's just get that perspective before we continue.
Okay, thank you very much. Thank you, viewers. Once again, I'm back to Gyna Plus, and I'm grateful to be here to educate our women about their health. Now, hormonal imbalance is actually a layman's term. It's not a medical term. It's not a gynecological term.
Oh.
It's a layman's term that tries to explain what happens about the hormones in women. Now, hormones are just chemical substances produced by the body that control events, metabolism, and events that happens removed from where they are produced. Now, we know that women of reproductive age, maybe between 15 and 49, the events that happen around them within their body are controlled by hormones. These hormones are essentially produced at some special parts of the body, from the brain down to the ovaries and liver produce some hormones. Now, the part of the brain that produce the majority of the hormones that control the reproductive system is just like a cascade, is a tract. We call it the hypothalamo-pituitary ovarian axis. From the brain, from the hypothalamus, there's a part of the brain called hypothalamus that is connected to part of the brain called the pituitary gland. From there, channel down to the ovary. The ovary and the uterus are the ones that are located within the abdomen. That, the ovary brings out the egg, and then the uterus houses the baby if the woman becomes pregnant. So there's a channel, a cascade. If anything happens to that channel, that the hormones are not produced at the time they're supposed to produce, or in the right quantity, or they are in excess, then there will be a problem along the cascade. So if whatever affects this cascade now will result in an imbalance. So in layman's term, if you want to explain it, you now call it hormonal imbalance. So that's what happens. But actually, there are terms, because there are different things that happen. The hormonal imbalance is not just one hormone that will have problem, and then it is hormonal imbalance. There are different ones that you see, but it is the gynecologist that will now diagnose from history, from checking the woman and the other things, what are happening. Then you will now know which of the hormones is affected.
Okay, so I like the fact that you already say which of the hormones are affected or might be affected. I would like you to highlight some of these hormones, but before you talk about that, what is responsible for one's hormone to actually fluctuate? Because I'm looking at it from a normal human being perspective, just the way I am. I probably feel I'm going about my life normally.
Yes, yes.
I don't know what's going on inside of me.
You.
So at what point does it shift? What is responsible for that?
Okay, let me say, just like medical sciences, the majority of the things that results in this hormonal imbalance are unknown. However, there are some that are known. Just stress could make one not produce hormone at the right time it's supposed to produce, like a clock, a set clock. If the clock begins to misfire, then the quantity or the amount, the time that is supposed to produce is not produced. Or even some diseases, like there is a disease of the gland that produce the hormone. If there is affected, it could produce it in large quantities that at the time it is not desired. We'll come to specific terms once. At the time it's not desired, it's producing large quantities of one that should produce milk. When the woman is not pregnant or breastfeeding, you find out that the person is having, we'll come to it.
Yeah.
So, but these are the small things. So, in milieu, there could be a shift in just what at the right time the hormone should be produced is not being produced, and the person will now have misfire of the cascade of events that should result, and by that time it will result in hormonal imbalance.
Okay, so now I'm also trying to understand this. I like the fact that you're opening my mind to a lot of things, and I know some other women too are like, okay, what is Dr. Duke talking about? Okay, so in a case where, for instance, I've heard of stories, I don't know how true this is, I mean, that's why we have you here, that you get to consume alcohol, that for women who smoke, women who engage in strenuous activity like exercise, that it might perhaps affect your level of estrogen. I don't know what that is. And just talk to us about this, really.
Okay, let me come. Now, there are specific hormones. I'll probably begin to mention the hormones at this point. Now, I will try to be as layman as possible so that I don't use technical terms.
Of course.
However, the names remain technical because you cannot change the names. Now, there are hormones from the brain, the hypothalamus. There's, in fact, the hormone that control the reproduction. One, what we call them gonadotropins. Gonadotropins are the hormones that stimulate the ovary. Okay, it requires now is your turn to begin to produce egg. The eggs need to mature. There are gonadotropins that are produced from the pituitary gland. Now, there are hormones in the pituitary gland, in the hypothalamus, that should tell pituitary gland to produce gonadotropins. We call them gonadotropin releasing hormones from the pituitary.
This one's, what do they do, the gonadotropins?
Gonadotropins are essentially what we call the follicular stimulating hormone.
Oh, okay.
That is follicles. The as the name implies, follicular stimulating hormone. Follicles are eggs.
Oh, okay.
Woman's egg. Follicular stimulating hormone and luteinizing hormone. Just leave it at that. Okay. It might be tongue biting.
Yeah,
but
it's already appearing.
Yes, it might be tongue biting, but that's the name. Unfortunately, I don't know. There is no name in Igbo or in other language. That's the way the people that studied medicine name them. Follicular stimulating hormone and luteinizing hormone. They stimulate the ovary to produce the eggs cyclically, monthly. So there is a point in time, at the time the person is menstruating, the follicular stimulating hormones are asked to stimulate the ovary to begin another maturation of an egg, because it takes about 14 days or thereabout for the eggs to get mature and get released. So there is measured quantity that must be produced at each point in time. Now, but before gonadotropins are released from the pituitary gland, there is a part of the brain called hypothalamus that is responsible to remind the pituitary to produce gonadotropins to act on the ovary. That one produces what we call gonadotropin releasing hormones. That is, as the name implies, gonadotropin releasing hormone. They stimulate the pituitary to release gonadotropin that will affect the ovary to produce estrogen and progesterone. Okay, so now if there is a problem in that, like somebody, like you mentioned, somebody that is taking alcohol, excessive quantity of alcohol could depress the what's it called, the hypothalamus, not to produce the hormone. For instance, somebody who is taking medication for one illness or that, like somebody who is depressed or taking antidepressant or taking maybe antipsychotic drugs, could affect the production of a certain hormone, because this medication could mimic the hormones that are produced by the body. And if they mimic, they act by receptors. They can go and attach on the receptor and start acting as if it is the hormone itself. So it could affect that. So smoking could also affect it. Somebody who engage in extreme exercise could also affect the clock ticking of producing her. So these are the things. But also somebody who is obese, for instance, could, because like I said, other parts of the body like the liver could produce hormones, and large quantities of fats, for instance, could be metabolized to produce estrogen, which is not coming from the ovary. And these hormones feed back to the pituitary when they are at certain quantities to say, pituitary, we are enough, don't produce again. Do you understand? Meanwhile, it is not coming from the right channel where it should come. It's coming from another source that is not the ovary. And it is telling the pituitary, don't produce again, when it should actually produce to stimulate the production of follicles. And it will make the woman not to ovulate, not to release egg.
And that can be a problem.
And that can be a problem. Gamut of problem. Well, I will begin to mention them. For instance, somebody who has a pituitary gland problem. That is, pituitary gland is a part of the brain, somewhere in the midbrain, that is responsible for producing gonadotropins and prolactin. The hormone we call prolactin is essentially for breast growth and milk production. Now, milk production and breast growth is supposed to happen when a woman is pregnant. Towards the end of the pregnancy, another hormone is produced to stimulate the milk from coming so that the baby will be fed. But it can happen that even when the woman is not pregnant at all or breastfeeding, that a certain hormone could begin to be produced in large quantities to affect and the woman will begin to produce breast milk.
Even while she's not pregnant.
Even while she's not pregnant or breastfeeding. And that's called prolactin. This prolactin could affect, because its production will affect the production of the gonadotropins, which are responsible for egg stimulation at the ovary. So, and if that happens, you find out that the woman may not be able to conceive naturally, because something is preventing the hormones that are supposed to stimulate the egg production. So you see that happens. And even in some instances, it could be a telltale sign. There is a tumor somewhere in the brain called the pituitary gland tumor, because if there is a tumor in the pituitary gland, is enlarged, it means it produces very large quantities of prolactin, and it will affect that. And even vision. So that's it. So if a patient comes, if a patient comes and begin to complain of one thing or the other, the doctor is trained, especially a gynecologist, is trained to know, oh, when a patient has this might be as a result of this. So you begin to ask questions and then channel his investigations, tests to do and find out, is it due to the tumor or just ordinary prolactin production?
Okay, so we would come back to some of these status. I'd like to be a bit more practical, Dr. Duke. I mean, you're doing a great job. Personally, I'm learning, because at this point, that one wouldn't have expected that just one hormone could or can influence the entire body system.
A lot.
I mean, we'll come back to some of the symptoms. Just watching Gyna Plus, by the way, right on Nafi television. Of course, it's been an eye-opening session, if you ask me. At this point, we'll take a short break and we'll come back to the discussion shortly. Please stay tuned. Welcome back. If you just joined the show, this is Gyna Plus right on Africa Television, and we are talking about hormonal imbalance. And of course, the doctor has said it's a layman term. I probably know at this point that you've gotten the technical term of what this is. Anyways, my name is Doris Mayum Shishi, and this is a program that comes up every Wednesday at 6 p.m. where you learn everything about your health as a woman. And if you're a married man or a family man, you're not left out in this program because it's a show for the entire family. What affects a woman affects everyone, if you ask me. And of course, I still have Dr. Dioko Nyabuchukwu. He is a consultant obstetrician and gynecologist at the University of Nigeria Teaching Hospital, Ituko Zala, Enugu. Dr. Dioko, we talked about quite a number of things, and you were on the telltale signs when we went on that break. So I'd like us to be a bit more practical. At a woman of a reproductive age, for instance, at what point should I want to see a doctor? What is that thing that will push me to the hospital?
Very good. Now, whether married or not married,
exactly.
There are signs you will notice in your body. You will want to know that you may have what we call hormonal imbalance. One of them is when, as a young lady, whether you're married or not, you're not pregnant and you're not breastfeeding, and you press your milk, because normally ladies should check their breast, and you press your breast and the milk is coming out. So what looks like milk is coming.
Even if it's watery, even if it's could it be some liquid sometimes? Or
no, however, when it is liquid and clear fluid and very scanty, you may not worry. However, you still need to see a doctor to reassure you. But if what is coming out is significant, like you press something and there's some significant amount of fluid is coming out, even if it's clear or milky, then you should be worried. Not worried that it's cancer, no. It could be what we call that sign of producing milk where you're not breastfeeding or pregnant is called galactoria. That's the term that is used, and it could be a telltale sign of hyperprolactinemia. Hyper means that it is high. There is high level of prolactin in the body. So you need to be investigating. You need to see a doctor, a gynecologist, to find out why you're having that. Now, the commonest sign, especially married people or even unmarried people see, or the commonest cause of hormonal imbalance, is what we call polycystic ovarian syndrome. Yes, what we call PCOS. Polycystic ovarian syndrome is just a name given to a milieu of symptoms and signs that a woman might have. And one of the commonest signs is when the menses becomes irregular. Now, irregular menses, normally, women who menstruate between 21 days and 35 days of every month is normal. We regard that as normal. But when a woman's menses begin to skip and last more than once he sees it, before you see another one, is more than 35 days, then is a sign that your body is not, because it should be cyclical. Your menstruation should be cyclical. So you should be able to see a doctor to examine you, that you may have what we call polycystic ovarian syndrome. And then in most cases, a woman gets married, and with the husband is fine, she is apparently healthy, and they are not able to conceive within 1 year of staying together and having adequate man and woman show, and they are not able to conceive within 1 year. You should see a doctor. It could be hormonal imbalance as a result of polycystic ovarian syndrome, and you are examined. There are other ways to find out also. You could begin to have hairs, what we call hirsutism. In the hairs, when you start growing hairs where what we call androgen dependent areas. Now, androgen dependent a man created man as the XY chromosome is supposed to have very high level of androgen that drives the body, makes him behave like a man. Places like mustache, this my mustache, is androgen dependent. A woman should not have hair, and in such areas, a woman should not have hair at the inner thigh, inner part of the thigh. A woman should not have hair ordinarily on the chest. These are what we call androgen dependent area, because it's androgen that drives the growth of hair at that area. When a woman begins to have that, and then the voice, the person talks, it's deep, and it talks like Yule Doche, and then it should be worried, because it could be that there's hyperandrogenism, because that's one of the signs of the polycystic ovaries. So you should see a doctor, because it could be the cause of why the person is not conceiving naturally. However, this is not something that should make the person very worried too
Okay.
much, because it has remedy and is treatable.
Of course, we'll talk about the treatment as we progress on the show. But I'd like to take you back a little bit for the androgen hormones you talk about.
Yes.
If that's what you called it. Would a woman just wake up one day and discover that her voice is taken, or she's developing hair on some areas which she's not meant to? Does that happen for an adult woman, for instance?
Yes,
Wow.
it does happen. It does happen. Hirsutism is different from somebody who is hairy. You could see a lady, she has hairs on her hand and on her hands, and maybe this thing is different from hirsutism. Hirsutism has a definition, and what is called is when the woman start growing hair on androgen, like the places I've listed, like mustache. You see a woman, ordinarily a woman should not have hair
So
there.
when hormones move from
Yes,
something
when
goes
the
wrong.
androgens begins to get high to the level of that of the man, then hairs will start growing there.
And that affects her
And that affects
fertility.
her fertility greatly.
Wow. Of course, I told you you're going to learn so much on the show today. And personally, I have learned a lot. And we're not going to end this conversation here yet. There's going to be a part 2 of this discussion, because, I mean, you get to learn about the treatment, what you can do, at what point should you see a doctor, and some of the misconception around hormonal imbalance. And Dr. Duke is not leaving yet. I mean, we are not leaving yet. We'll be here, and you see us next week. But should you have a question or any concern, and maybe want to learn more about this topic, you can visit our YouTube channel, Afia Culture and Lifestyle. There you'll see Gyna Plus, and then drop your question, because this part 1 will be up on our channel and running. So at this point, we will say bye temporarily. We'll see you again next week. But before we go, we had Dr. Duke Onyabochukwu, who is a consultant obstetrician and gynecologist to University of Nigeria Teaching Hospital in Tukozal, of course, Enugu State. And my humble self, Doris Mayim Shisha. You see me again. We're just taking a break, by the way. See you next week.